My name is Susanna. What's your name?
My name's Katie, as you already stated.
Oh, yeah. So tell us what brings us here tonight.
So the reason why Susanna's in Chicago right now is because I have surgery in the morning.
What time?
The surgery's at 7:30.
And would you explain to us a little bit about what this surgery is going to be about?
Sure. So we have to be there at 6 o'clock in the morning. Woohoo! So I'm going to be somewhat of a cyborg, according to one of my friends. This is to help with my seizures that are intraceable, and so far no anti-epileptic drug has worked on. And what they will do is open up a pocket of skin underneath my collarbone here to insert a generator. And then they're going to take a lead wire up underneath my skin and find a lovely little nerve in my neck and wrap that wire around that nerve so that in a few weeks they can turn it on and it'll send stimulations to my brain through, I guess, electrodes, whatever you want to call it.
Fascinating stuff, Katie. Thank you for sharing. Now tell us, when will you be able to shower after surgery?
Not immediately.
So what is your solution for staying clean?
Don't get dirty.
There you go. So, Katie, what does post-op recovery time look like?
So it's different for every individual. But I'm not allowed to do house chores or lift anything heavier than a gallon of milk for the first 4 weeks, according to the paperwork. I don't know if the doctors say something else tomorrow. And limiting the amount of exercise I do as well. And I can't have water hit the incisions. I'll have 2 of them directly. They can roll over it, but I can't hit it directly while it heals.
So Katie, tell the world what you will have Susanna do while she's here for that first week.
Susanna's going to sit there and smile and look cute. No. She just rolled her eyes at me. We're going to celebrate Christmas because it's now 3 days away. Because it's now 3 days away, almost 2.5. And Susanna's going to help, I guess, get food for me if I need it, and brush my hair if I need it, and all of that other fun stuff that comes with not being able to lift more than a gallon of milk. And Susanna can't lift things over her head.
Yeah, nope.
So we'll not be doing that.
Nope.
And we get a party and watch movies and whatever else that Susanna wants to do.
So what are some of those movies that we've already picked out, Katie?
They're sitting over here. So we've got X-Men Origins.
Ooh.
And Unbroken.
Classic.
And
not really.
We Are Marshall.
That's classic. There you go.
And Independence Day.
Ooh.
And How to Lose a Guy in 10 Days. I can't talk. The Devil Wears Prada and The Bucket List.
So what out of all those movies are you most looking forward to watching?
I mean, I've seen pretty much all of them, but the top 3 of those that I like are The Devil Wears Prada.
Mm-hmm.
And the X-Men movie.
Mm-hmm.
And I'm trying to think which one I like next. Probably The Bucket List. The Bucket List is pretty good.
It is.
Morgan Freeman, you know.
Now, Katie, any concluding thoughts as we end our first video session together?
This means that we'll have a second one.
Yeah.
And possibly a third and fourth. I don't know.
We'll have one every day.
Woohoo! Concluding thoughts. So, my post-op surgery buddies, besides Susanna, is Piglet and Pluto, and Mr. Monkey came to visit as well, so he'll be here they partied a little bit too hard and they need to go to bed. But yeah, I think that's enough of concluding thoughts because we have to be up I have to be up in like 8 hours, 4:30.
So do I. Oh, I see what you're saying.
Yeah, so I can actually take a shower.
So, Katie, how long will your last shower take?
I don't know, as long as it needs to. Probably
last shower in 1 month.
No, like a week.
Oh.
No, it'll probably last as long as it normally does, which is like 10 minutes. Because I'll be an autopilot and not think about it. The thing I'm not looking forward to most tomorrow morning.
Oh, that was gonna be my next question. I'm glad we could read our mind.
Is not drinking coffee.
Oh yeah.
Because I'm used to drinking at least 1 cup of coffee before 5 a.m. And getting to the hospital at 6 and not getting coffee at all probably tomorrow. Or eating breakfast. I don't get to eat after midnight tonight until I get home.
So what was the last thing you ate, Katie?
For dessert today, I had a blueberry muffin because I can't have one in the morning, and I had a Gatorade. Oh. And for dinner, I had a pulled pork sandwich and some of my broccoli cauliflower cheese soup,
which was delicious.
It was.
Okay, world. Peace out.
At some point, Susanna will show her face. I promise she's not a figment of your imagination.
We'll see. Bye!
The cupped princess wave. Bye, guys.